Well, I mean, for starters, when the question was initially posed, I was thinking about our college and thinking, well, you know, we are called arts and sciences. We're not called something like arts or sciences. You know, it's I think we already, as being part of the college, come from a place of that these two are interconnected and can collaborate and, you know, are equally important in terms of students' education. So that's kind of where I started from with.
But yeah, I think the liberal arts aspect of the education is critical in terms of helping students think critically about issues and realize that across disciplines, a lot of the same issues are being addressed, but from different perspectives.
You know, the in terms of health sciences, I mean, we're really seeing a lot of progress in joining arts and sciences and humanities. You're seeing a lot of interventions. There's a medical social worker who has been going into different nursing homes and loading up iPods with music, and he'll find out he'll talk to the staff and ask about some of the patients with dementia and you know, what music did they used to like to listen to. Load these iPods up and put it on them, and all of a sudden you see them just kind of come alive again, where they haven't been verbal in years. And you know what that does for the individual, but also the staff that works with them on a day-to-day basis. It's actually a documentary called Alive Inside, and it's amazing to see music used in this capacity to help people come alive again. And a big piece of that too is this, it's not really a new area, but it's really becoming more central in terms of attention, is health literacy.
Right.
And so, you know, which focuses on how do you communicate health information to individuals.
Right.
And then what they do behaviorally with that information.
Exactly.
So that, you know, in terms of communication studies, English, social work, psychology, all of these disciplines kind of come together in that particular area. But you know that you can that you know, and at what level that patients can read and understand health information, and how practitioner can intervene and help individuals become improved in health literacy.
The other one of the other interesting things that my colleagues and I have been working on shows that how people make decisions and actually the types of information that people consider changes as people get older. So often in medical situations, one of the things that we are faced with are different treatment options. So, you know, there's a given treatment, you can do medication, you can behavioral intervention, diet and exercise, maybe there's a couple different medicines. There's over-the-counter, like you were saying before, there's maybe some folk medicine, some herbs, herbal remedies, or that sort of thing. So how do people decide from all of these choices that they have is an important issue. And what our research shows is that as people get older, they tend to search through those options until they find something that's good enough.
In terms of research, they've actually have shown in terms of outcomes that the use of arts and humanities in health settings has been beneficial to patients as well as practitioners. For example, they've shown that it's improved mental health, has improved the relationships between practitioners and clients and patients, reduced hospital stays, and reduced the need for medications, which are, you know, all things that you want out of a health care scenario and situation with patients.
Right. So yeah, I know there's been some discussion of like what's the in like the Chronicle of Higher Education and stuff like that of what's the value of a liberal arts education. Shouldn't we just be like, you know, giving students technical skills? Well, technical skills and techniques become outdated.
Come obsolete, right, right, and fields change, and
Fields
it's
change
just,
rapidly.
although we all need to, kind of continue our education and stuff, but it does. I mean, it completely.
Right. Yeah. So if you don't teach people how to find information and then how to use that information, then you're doing them a disservice, I think.